Hi, everyone. Welcome. Hi, everyone. Hope you're having a good week. Just give it a couple of minutes while folks join. All right, we can get started. Hi, everybody. Hope you're having a good Tuesday. Thank you for joining us for our session 3 of the Northeast Collaborative. We'll go ahead and get started here. Please be sure to update your Zoom name. Feel free to, come off mute to enter any comments or questions into the chat. We would love to have you engage and have a conversation with you all today. Our check-in icebreaker question today is, what is your favorite spring activity? So feel free to put your answer in the chat or to come off mute. Gardening, that's a great one. Hiking in the wildflowers, baseball and racing season. Anything getting outside. Yeah, I'm really enjoying spending time outside these days for sure. Rodeos. Awesome. We'll keep putting your answers in the chat. Love hearing what everyone is going to be up to this spring. And just as a reminder, this is really a space for all of us stakeholders in the Northeast region to collaborate, identify challenges, and problem solve with the goal of improving CalAIM implementation and driving utilization. Welcome everyone who has attended sessions previously, but just want to pause here and see if there's anyone new to the Northeast Collaborative. And if so, please feel free to come off mute or say hello in the chat. We'd love to say hi. All right, maybe we all have returning. Oh, hey, Wendy. Thanks for being here today. We're excited to have you. And we'll be hearing a little bit more from Wendy later about First 5 Shasta. Hi, May. Hello. Any other new folks, please feel free to say hello or say put a comment in the chat where you're joining us from. All right, so moving on. For today's agenda, we'll be having some updates related to community supports definitions. We'll have a regional spotlight from First 5 Shasta, and we'll also have partnership joining us with some MCP updates. And then we have that provider spotlight from First 5. We'll be having a billing primer for office hours. So we'll be hearing about unit assignments and modifiers, and this will be sort of a preview for an office hours we'll be having later this week, and we'll give you some more information about that. And then in part 4 of our agenda, we'll be talking about our sustainability framework and then next steps, future sessions, office hours, one-on-ones, things like that. So our objectives for today are to understand and review refinement and updates to those DHCS policy and community supports updates, to receive important MCP updates and stay informed with peer activities, to explore collaborative sustainability and leadership development by discussing strategies to strengthen our local provider networks, enhance skill building for long-term impact, to gain insight into the children and youth population of focus, learning about available services, resources, etc., and to briefly touch on billing and claims best practices in preparation for a dedicated office hour. And now I'll pass it over to Gretchen to talk about some updates and resources.
Thanks, Ava. Hi, everybody. Hope you're all having a good Tuesday. We're getting some sunshine where I live in California, so I'm super excited about that. Hope you're getting some sun up there too. So we have a lot of updates to cover, and we have a lot of slides here, which has the great reference information on it. I'm not going to read all of them, but just know you have that there. And there also are some links in the slides to the DHCS document. So we will get going. If you can go to the next slide, please. So you may have already seen this, but the federal government did do made some changes to the guidance they provide to states around how they want to incorporate services addressing health-related social needs into Medicaid programs. I think there's a lot of concern amongst all of us who are doing community supports here in California with this change, how we're moving forward. But thankfully, DHCS has put out a statement and has checked with CMS to verify that all the community supports will not be impacted by this new, the change in guidance. And so we can rest assured, since we're under the waiver, that we have a few more years of community supports, how they're structured now. Next slide, please. So we also wanted to cover the community supports updates, the state release. They put out some guidance documents back in February. We hear they will do a full update to the community supports policy guide in April, which will include these updates as well as updates to the housing trio of community supports and transitional rent. So we're very excited to get all of those updates. But in the meantime, I wanted to share with all of you what has been released so far, and we know these will take effect starting July 1st. So we have some time to adjust, and partnership, feel free to jump in here if you have anything to add. I see that Ashley here is on the call. So the ones that we're going to be looking at today are nursing facility transition, diversion to assisted living, community transition services, asthma remediation, and medically tailored meals and medically supportive food. So if we can go to the next slide, please. So a lot of these updates are really trying to clarify the policies for these particular community support services, and really trying to also look at what are the potential duplicative services you may run into with these community supports and what's allowed and what is not allowed. For this particular one, nursing facility transition and diversion to assisted living facilities, we're trying to really clarify the eligibility criteria, and then be very clear there are two distinct components to this community support. One is around transition services and expenses, and one is about the ongoing assisted living services. And so really clarifying what those two distinct pieces are. And then again, trying to make sure that we're not duplicating services and billing. We're trying to ensure that we have other community supports, as long as they don't duplicate each other. You can claim for this community support and others. But there are some other waiver programs where we don't want to have you perform both community supports as well as the waivers, and that would be the assisted living waiver and the California community transition. So just be aware of that and make sure you're checking to see what other programs folks are enrolled in before you either refer or start billing for community supports. Next slide, please. So again, similar things here, community transition services, nursing facility transition to home. Really want to clarify what is duplicative and what is not with waivers and with other community supports. But just making sure that we all are clear on what the two different components of this community support are. One is the transitional coordination services, and what are those one-time setup expenses. So again, lots of details here. We do have the link to the DHCS document, but just want to make you aware of what's coming as of July 1st if you are working in these community supports. Next slide, please. So asthma remediation is actually a pretty big change. I don't know if there's anybody here who is doing asthma remediation. If you want to raise your virtual hand, let us know. Essentially what's happening here is we have the community support, but we also had a Medi-Cal benefit go into effect about 6 months after community supports launched, which has some of the same services in it as this community support. And so what we're focusing on here is that you have until January 21st, 2026 to bill these services that are in both the community support and the Medi-Cal benefit through either one. But after January 1st, you will need to bill some of these services through the asthma preventative benefit, which would require you to become a Medi-Cal provider. So if you do provide these services, you want to look into what that will look like and what it will take to become a Medi-Cal provider for asthma preventative benefits. Any questions on this one? Christine, I see your question. Are these community supports available through PHC already? I'll let Ashley come on and answer that.
Hi, everyone. Can you hear me okay?
Yeah.
Okay, perfect. So those 3 community supports are not any of the services that Partnership has elected to provide. We only have the medically tailored meals that we'll discuss today.
Do you think you will be adding any of these services in the future, Ashley?
I don't believe so. I know we did offer the nursing facility transition to some of our expansion counties because they were providing the service, so just for continuity of care, but I believe that has ended, and we don't have any plans to address those in the future, but I can take that back to the community support team and just confirm.
Okay, great. Thank you, Ashley. Appreciate that. Christine, I see your next question about any updates on home modifications. Right now, there aren't any, but we've heard from the state they're going to be doing this kind of rolling updates to community supports. We know the next policy guide updates will come out in April, but we've heard they're going to be doing it throughout 2025. So more to come on that. And of course, as soon as we hear anything, we'll share it with you. Renee, I hear you're asking about transitional rent. We're all so eager to learn more about transitional rent. Again, we anticipate getting more guidance from the state in April as part of the community supports policy guide update. So yeah, as soon as we know anything, we will share it with you guys. And Ashley, I'm going to just confirm this. I think we have this last month, but you guys do not intend to offer transitional rent until January of 26. Is that still the case?
That's most likely. We're talking internally about what that's going to look like, hiring with the intent that it is going to go live soon, but we don't have a defined date yet.
Okay, that's what I thought. I mean, most managed care plans are trying to figure all this out and there's not a lot of time, but let us know if you guys go earlier. That'd be exciting. Any other questions here? We'll go on to medically tailored meals, which is the last. Okay, Renee, go ahead.
Well, my question is if Partnership is going to like possibly start transitional rent in 2026 when it comes to us, you know, applying for cited or for the CalAIM grant, should we not include that or should we include that?
So transitional rent is mandatory for all managed care plans to offer January 1st of 26. So I'm assuming Partnership will be in compliance with that. So I think if you're applying for cited, a good target start date would be January 1st.
Okay.
And Ashley, correct me if I said anything. That's fine.
I see Ashley nodding. Thank you. Thank you, Gretchen.
Yeah, of course, Renee. And keep asking the questions. We're all eager for all of this information on transitional rent, but we just don't have a lot from the state still. All right, next slide, please. All right, so medically tailored meals and medically supportive foods. So again, trying to just refine things with this particular community support, really making sure that we're looking at the eligibility and who's eligible. And I think there's been a refocus of this community support onto folks who have the nutrition-sensitive health conditions or medically tailored meals can support that. And we want to move away from having this be used to address any food insecurity issues, which there had been some managed care plans who had been using it to do food insecurity. So really trying to refine that. And there's additional requirements for this one around managed care plan oversight of the services being offered. So again, a lot more details. We have all this linked, but just wanted to make sure you're aware of what's happening. And the state is, I think, trying just to refine community supports a little bit as we're all going through this. We're learning a lot about what's working, what's not working, what's too much, what's the right amount. So the state is really trying to do this, and I think we'll see more of this throughout 2025. All right, next slide, please. So I also want to make you all aware of some housing and homelessness resources. The state did have a really great webinar last week looking at the housing trio and community supports. And they, at the same time, they also, the state California Interagency Council on Homelessness did release a 3-year action plan for preventing and ending homelessness. And what's exciting about the council is that they are actually comprised of different department heads, different experts in the state. So you're having a lot of different funding resource, a lot of different brains come together and say, how do we work together to really address housing and homelessness? So that's what the 3-year action plan is going to reflect. So I would encourage all of you, if you're working in this space, to check it out. They also are working on trying to combine all of the HMIS data and the COC data from across the state into the homeless data integration system. And then they're starting to share that data with the Department of Healthcare Services, with the State Social Services Agency, and trying to figure out of all these individuals that we're working with that we see in the HMIS, how many of them are utilizing other public resources. So just wanted to make you aware of that. I cannot wait to get more analysis from the state about how folks are utilizing resources, which I think will also help us as we move into transitional rent, as we continue to serve folks who are experiencing homelessness. And then last but not least, during the presentation from the California Healthcare Foundation and the state on these projects, they did also have a really great webinar with a lot of good data, which I think can be helpful to all of us working in the space, especially if you're looking to write grants. There was some really good research about, who's experiencing homelessness, what are some of their health conditions, what are some of the predictors of folks becoming homeless. So I think it's a lot of good data to check out. And those are all linked here as well. And I see that Ava's also dropped them in the chat. Thank you, Ava. That's really helpful. Any questions or anybody who attended that webinar? Want to add anything here? Loretta, did you attend? Okay, great. I hope it was helpful. I really enjoyed it. All right. I'm going to now turn it over to Ashley for the partnership updates.
Thanks, Gretchen. All right, next slide. Perfect. So we've got a few updates today. The first one is going to be the closed loop referral provider reporting changes. And then we will go over our CalAIM webpage, and then again, funding opportunities and our justice involved ECM provider training. Next slide, please. And one more. Thank you. Okay, so as you know, closed loop referral requirements do go live as of July 2025. So we are working internally to make those needed changes based off the guidance that we've received from the state. We are still working on making all of those changes, but we did want to have an update for all of our providers that may be coming down the pike here soon. So these are going to affect our monthly reporting templates. So what that's going to look like more specifically, the MIF for ECM is going to include a referral type. Right now it does have a referral source indicated where the referral came from, but per DHCS, it does need to define whether the referral came from the community or if it was identified by the managed care plan, excuse me. So that's going to be informational on the MIF. For ECM, the RTF is going to have a few new columns that our providers are going to be responsible to complete on a monthly basis. And this is to indicate what happens when we send a referral. So the referral status is going to be added, and then the date of the referral status. So whether the referral was accepted and on what date, and then a reason for a closed loop referral closure. So the closure is going to be any reason why the referral is being closed, which is going to include the member declined services, if the provider doesn't have the capacity to take that referral and we need to reassign to another provider, or if the member agreed to enroll in ECM and a TAR was submitted and that member is now receiving services. Those are all examples of why we would close that referral. And then also we are going to be adding a column for the ECM lead care manager's email address. And this is all DHCS requirements to document for our providers. And then the plan will provide that information to DHCS. So again, those will be coming out soon. For community supports, there will be a few updates as well. For the ASF, the referral type, just like the ECM MIF, will indicate where the referral came from. But again, July 2025 is when these changes go live. We have draft updated templates, but we need to go through all of the appropriate channels to get those approved. So we will make sure to keep you all in the loop when those closed loop referrals, no pun intended, go live. Loretta, go ahead.
Hi, good afternoon. Thank you, Ashley. So my quick question when I just listened to you is, how is the reason for the closed loop referral closure different from the discharge recommendation for discharge reason? So I'm like, are they the same? What am I missing?
Great question. We had the same confusion at first because it does seem a little bit duplicative. So the status of the member engagement, which is currently on the files, is going to indicate the member's complete history in ECM. That is their involvement in the ECM program. The referral status is just going to tell the story of what happens with that member's referral. So the member may have a closed referral closure, but they may still be open to ECM because if they are enrolled, that's a reason for the closed loop to be closed. So it'll be a little bit different. It's the member's current status in the program versus what their status of the referral that we sent on the file is, if that makes sense.
Thanks. A little bit. I'm still trying to fully understand it. But when you said the referral, I'm assuming you're referring to only the referrals that came through the MIF. Okay.
Correct. Yes.
Thank you.
Great question. And Chris, I agree with you. It would make sense to be on the IoT, but the requirements are to have it on the RTF. And of course, the outreach should be documented on the IoT, but they do want that referral status and the date on the RTF. Okay, next slide, please. And one more. Okay, great. So I know we've announced this a couple of times now, but we wanted to bring it up again. We are launching, well, we have launched our CalAIM webpage. So before we split out our webpage and there was one for ECM and one for community supports, we have since merged that into one webpage because we are one department now. So definitely check us out on that webpage. We are going to be decommissioning the ECM and community supports subpages here soon. So if they go away, that is why, and we have the combined CalAIM webpage for you. Next slide, please. And thank you. So I apologize, it looks like the slides may be a little cut short, but I believe all of the information is on there. Just a reminder that Pathfighted is currently open and application deadline was extended to May 2nd, 2025. This is through DHCS. So if you have any questions, the next slide, please. We encourage you to attend any of the DHCS PATH webinars. And then we also linked the resource where you can find additional information. Next slide, please. Perfect. And then we also have IPP funding, and that is through partnerships. So applications are currently open now on our CalAIM webpage, and we have grants open for following categories. It's the justice involved population of focus to build capacity, access to either building primary care provider or specialty access in order for members to establish care, a focus on the rural communities, and then building capacity or expansion of the short-term post-transition housing or short-term recuperative care facilities. And those applications are due by 5 p.m. on May 16th. And if you have any questions, feel free to reach out to us at the grants partnership email address. Next slide, please. Okay. And then another friendly reminder, we are hosting a Justice Involved ECM webinar for our providers. This is for the providers that are serving our Justice Involved population of focus or are interested in serving this population. So we definitely encourage anybody that's interested to attend the meeting next week. It's on Tuesday, March 25th. And the registration is on the slides, but we also have it on the webpage as well. Next slide, please. I believe that might be it. Perfect. Are there any questions that I can assist with today?
The one in the chat about this being the last round of IPP.
I believe so. That is what I have heard.
Any other questions for Ashley? Well, great. Thank you, Ashley, for the wonderful updates. We appreciate all the information you've been sharing. All right. Well, now I'm super excited for our provider spotlight. We're going to have Wendy Dickens from First 5 Shasta come and let us know what they're up to these days. All right, Wendy, I'll turn it over to you.
Thank you so much. So I didn't do a ton of slides because I felt like they aren't always what you want or need to see. So, but I, like already mentioned, I am Wendy Dickens. I am the executive director over at First 5 Shasta. And if you want to go to the next slide. We are an organization that actually is funded through Proposition 10, which is a tobacco tax, which came through the California voters in 1998. So every county has a First 5. So there's a First 5 Modoc, there's a First 5 Tehama, there's a First 5 Butte. And so we work a little differently, nuanced in an opportunity to make sure that our own communities are getting what they need at that time. But we also we have similar goals many times because we are funded in dedication to education, to healthcare, to development, to the overall well-being of and development of the youngest members of our society. So we really have to look at all of the different pieces of what creates an optimal opportunity for development. So next slide. So the reason this came about is because we understand that the first 5 years of life really are kind of the pinnacle point of development when it comes to foundational brain architecture. And so, Rob Reiner actually really promoted this very heavily at the legislative body before it became, a proposition. And so really our goal is to make sure that we are supporting families because, babies don't grow up by themselves. So the experience that we are going to provide to a family comes through a variety of different opportunities, all the way from prenatal care and making sure that is happening for families in an easy way, that there's no barriers, that we find those barriers and try and reduce them or mitigate any kinds of things that are preventing people from obtaining services, all the way through kindergarten readiness, really. So, making sure kids are ready for school in the formalized settings in the best possible way. So childcare, along with early educational settings of a variety of types. And so next slide. So really kind of just exemplifying what I just talked about really is like that, making sure that prenatal care is happening all the way through, because we know that during that synaptic pruning, what hasn't been happening is going to go away, right? And so if we're building good brain structure, it's the, going to provide for an opportunity later in the future for less intensive services to happen and shorter duration if an intervention needs to occur. So we really want to help families in their early stages, right? So it's really helping parents, helping, provide all of the different things that we would need to do. And so I should have provided a Help Me Grow slide in there, because one of the things that we do in an opportunity to ensure that parents have all of their questions answered through a variety of means is to make sure that Help Me Grow is one of the pieces of resource that they get. So the resource for Help Me Grow, I just put in the link for you guys in the chat, but Help Me Grow really does provide an opportunity for parents to ask questions, to get an ages and stages questionnaire completed, to get a referral to a provider if necessary, but also to get some tip sheets if they don't need a provider, so they can get referred to Far Northern Regional Center, to other services, or to just ask questions. So many times when we're working, First 5 Shasta specifically doesn't necessarily, do anything to bill CalAIM or do any of that sort of thing, but we help all of the providers. So we have, we do grants out into the community. We just recently did a lot of grants to the midwifery group here, to the doulas, and then we talk to them about how they might need to set up the billing situation for themselves, and then provide them with, any supports that might come around that. We also have healthy babies around, and so we provide the opportunity for parents who haven't quite yet gotten all of their health care up to, date, get services around prenatal health, mental health, and then any of the postpartum depression or anxiety that can occur afterward. So we're constantly looking for those types of things. And most of the first fives across the state are doing things where they're either supporting within the community through things like Help Me Grow or Healthy Babies or systems change work. We have a home visiting collaboration here that we are really trying to ensure that there's no duplicative, services, but also that families aren't on a waiting list forever and ever, right? So we talk about that. They're not getting, the same service from 4 different agencies, but also they're getting the right agency. And so we do things like that. So we're connectors across the state. We're also supporters. And then there are a few first fives across the state that are doing the CalAIM, billing for people. So anyway, so I think I gave quite a bit of information. I'll stop and take a breather and make sure there's no questions, or if there's anything people have burning on their minds they want to ask.
Any questions actually, Wendy, I have a question for you. If folks wanted to get in touch with you about referrals for ECM or community supports, who is the best person to contact? Is it you, or is there another staff member they could reach out to?
Yeah, they can contact me. I'll put my information in the chat, as well as they could probably just call Help Me Grow and get in or on the website for Help Me Grow. But I'll put my information here too.
All right, wonderful. Any other questions for Wendy? Well, Wendy, thank you so much for joining us today. I really appreciate your time and your presentation.
Thank you for having me, and I hope it was helpful.
Yeah, it was great. Thank you so much.
Thank you.
So we're going to continue on the children and youth theme here, and we wanted to give you all a chance to really uplift your voices to the state once again. The state is wanting to get more information around California Children's Services and the population of focus there, and what they can do to really support providers with serving this population of focus, as well as what other key strategies or examples you all are employing or have seen that would really help these children and families get the services they need. So would love to hear if anybody of you is serving this population of focus, what you've seen that is working, what you'd like to tell the state about what TA would be helpful for you in this work. So you can put that in the chat, or I'd love to have you come off mute and share with us what you've seen out there, what's working, what's not, how the state can be helpful. Does anybody here work with the CCS population of focus?
This is Wendy from Disability Action Center. We've signed up for that, but we are just brand new, so we haven't really got any experience yet.
Okay, well, I'm glad you're doing it. Anything that would be helpful for you as you start out in terms of TA trainings, anything else that would be helpful?
Yeah, I haven't had any trainings on this aspect of doing this service yet, so I don't even know what's out there yet.
You don't even know what to ask. Yeah.
Yeah, they're still going through all of the, the reports and stuff with us. So we haven't got any referrals yet in this area because we haven't done any trainings yet. So I am really absolutely brand new, like only started this a week ago.
Well, I'm glad you're here today. Thank you for speaking up. Yeah. Anybody else have anything? All right. Well, if you think of things, please drop it in the chat. We do want to make sure the state is hearing from all of us here in our Northeast Collaborative. So feel free to drop in some suggestions here, and we'll put that forth to the state. All right, let's go to the next slide, please. So as we wrap up this section of our agenda, just wanted to give folks a chance to share what spotlights you guys want to lift up, any meetings that are coming up that you think would be important to share for your other providers here, any successes. I always love hearing the successes of what you've been working on for ECM or community sports. So I will give you a chance to share. Okay, well, if you think of things, again, drop it in the chat. Especially if you have any successes, we'd like to celebrate those with you today. All right, we will keep going through our agenda. So next we're going to turn it over to Angela here to talk about the billing primer for our office hours on Thursday. Angela?
Hi. Hi, thank you, Gretchen. Good afternoon. My name is Angela Ayala, and I am a billing and claims expert. We will be having an upcoming office hours session Thursday to talk about more billing topics, challenges. And so we wanted to take some time today to invite you guys to attend. We'll have more information on the office hours in a few slides. Today, I also, if you can go to the next slide, please, Ava. Thank you. So today, I kind of just wanted to talk about billing fundamentals. Accurate billing starts with correctly assigning units and using appropriate modifiers. These elements ensure that claims are processed correctly, reimbursement aligns with services provided, services that are provided, and compliance with Medi-Cal guidelines is maintained. During this section of our session today, we will break down how to determine the right number of units for different ECM and CS services and understand when and why modifiers are necessary. Understanding these fundamentals will help you streamline your billing processes, reduce errors, and support your claim and invoice adjudication. So let's start talking a little bit about unit calculation. And so this first slide kind of just gives you a brief summary of the units of measure that are utilized for the services that are provided through ECM and CS. So depending on the service you provide, you may have to allocate units based on the time that you spent with a participant, per diem or per day, per month, or you know, there's a lifetime benefit that you only get to use once. So primarily the one that we see people struggle with is for our outreach services, for our 15-minute intervals. And so sometimes there's questions about how many units do we bill for unsuccessful outreach? And so I just kind of wanted to make a brief note that for unsuccessful outreach, when you are submitting code information for those services, you would default it to 1 unit. And then for based on the amount of time that you spent with your participant, DHCS has given us some guidance called the Rule of Eights. Ava, would you mind going to the next slide, please? So this is a brief summary of the information DHCS has provided around the Rule of Eight. There's reference information at the bottom for you guys. If you wanted to get more detailed information, we will be sharing the slides after the session. But essentially, when we are billing for units of time in 15-minute intervals, increments, you typically would think that the first unit is billable at 15th minute mark. Second unit is billable at the 30th minute mark, and then the third unit would be like 45 minute mark. DHCS has given us some grace around that, and so essentially we have a 7-minute grace, and the bottom portion of our slides kind of gives us a good visual indication of that. Essentially, what DHCS has come in and said is, during your outreach sessions, if you are spending a minimum of 8 minutes with your participant, then that would mean that you have a billable unit for that service, right? And so the grace period for the first unit would be within 8 minutes to 22 minutes. And then that 8th minute in excess of those 15 minutes would then become your second unit. And so I just kind of wanted to give you guys an opportunity to obtain that information, get some visual indication, and then see if you guys have any questions specifically on unit assignments for 15-minute increments. Amanda, I see you're raising your hand. Do you want to ask your question?
Yeah, so in the past, we have asked this question on these calls. So for the outreach calls, for ECM, the new $5 charges that we're able to bill for, does that include? Ooh,
Can you repeat your question?
sorry, my computer turned off for
I'm
a second.
sorry, yes, you cut off a little bit.
It was weird.
Yeah.
So we have asked about the like no answers on the ECM outreach calls for the $5 charges, and we've been told that we can bill if they don't answer. Is that not true? Do we have to talk to them for a full 8 minutes before we can bill?
No, no, you can, right? For outreach for ECM, you can bill for one attempt, I believe, which would be 1 unit.
Okay, just
Yeah.
wanted to clarify.
Yes. Any other questions around that? Nope. Okay. And so we can move on to the next slide. I have some examples here for you guys as it pertains to other units that we also see when providing services. So the first example that I have for you up top is for an ECM case management service for a non-clinical staff. And essentially the table of information that you have there is typically what is presented to you in an authorization. And so really the big take from this is it is always important to reference your authorization, see what the approved service is. And so typically the authorization also speaks to the health plan's expectations when it pertains to claim submission, right? So this first one under the frequency column, you can see that the unit measure is per month. The authorization has been approved for 6 months. You can see the coverage period is from February 20th through August 20th, and the amount of units that have been approved for this service are 6, because we would be submitting 1 unit per month for case management. On the second case, this is a community service support service, and this is for our housing transition service. And so this one, the unit of measure is per day. And so again, the authorization is good for 6 months, January 24th through July 23rd. And so the approved unit amount is 180 days, meaning that you would be able to bill 1 unit per day. And really, this depends on the health plans, but I've worked with health plans where they prefer that you submit 1 claim per month versus 1 claim per day. However, that is sort of the allowance based on the authorization information that's been provided. Okay. Do you guys have any questions on these examples? Nope. Okay. Let's go to the next slide, please. And then the second topic that I wanted to talk to you guys about today was modifiers. Understanding how to use modifiers appropriately is critical to ensuring accurate claims processing and proper reimbursement. And so what I've done for you in these slides is kind of broken up the typical modifiers used for our ECM program versus our CS program. For the ECM program, there's really basic. There's really only 4 modifiers that you use. U1 is when services are being provided by a clinical licensed staff. U2 is for non-clinical staff. GQ talks about the modality of the service. So if you are doing in-person case management, for example, you would not be using a GQ modifier, but if you are doing telehealth or telephone, then you would be appending a GQ modifier to your code. And then the U8 would be for those outreach services where you're seeking pre-enrollment for ECM. And then for our community supports program, there is a handful of modifiers to use per partnership, because they don't cover all of the services available under community support. Typically, the ones that you would be using the most are U6, U2, or U3. So U6 is just an indication that the service that you're providing is a community support. So typically, by default, that is the modifier that you would be using for the vast majority of the community support services that you are providing, U2 specifically for your housing deposits. And so that one is used for alongside your H0044, right? That H0044 is a code that is also used for short-term post-hospitalization housing. And when using that code for short-term post-hospitalization housing, you would use a U3 versus a U2. And then U4 and U5 are for your nursing facility transition services, which is not something you currently use right now. And so the U4 is when you're transitioning to home, and then your U5 is when you're transitioning to assisted living facilities. And for you guys, that would just be informational. Next slide, please. One thing that I did here for you guys, based on a documentation that was recently updated by DHCS, is give you examples of roles that would qualify for your modifier U1 under the ECM program. And so the big takeaway from here is that when when a participant of ECM is being serviced by someone that holds a license, then you would be using a U1 modifier, right? So that would be your LVNs, your RNs, medical provider, a physician assistant, nurse practitioner, and so forth. And then the U2 modifier, Ava, if you can go to the next slide, includes your certified roles as well. So the big takeaway from this one is if the provider is not licensed, right, but they are certified, then they would come into, you would be using a U2 modifier. And so then I have given you some examples of these, like a medical assistant, community health worker, promotoras de salud, or doulas. And I believe that's really all I have. Do you guys have any questions on the material that we've covered so far? No. Okay, I think we have a brief survey. Oh, Wendy, I see you rose your hand. Would you mind unmuting?
Yeah, I just had a question on your last slide for non-clinical staff, because we are not a we're not a clinic, we're an independent living center.
Mm-hmm.
And so under your non-clinical staff, that still doesn't really include us.
So these are just examples, right? If
Okay.
you're it would include yourself if you're non-clinical.
Okay.
Yes. It's not exclusive to this list. I just wanted to have some roles of reference for you guys.
Okay, thank you.
Mm-hmm. I believe that last slide talks about a survey for you guys today. See if you found this information useful. And again, I want to encourage everyone to attend our office hours, bring in case studies, specific questions that you may have geared to your practice, and we can address them. Just make sure there is no PHI, please, that they're de-identified. I also want to mention that in preparation of the session, I went ahead and referenced the partnership website to ensure that I was referencing up-to-date information, and they have a wealth of reference material there for you to access. They have documents that talk about rates, frequency, and then they also have training videos. So I just wanted to make you guys aware of that. Okay, thank you so much for your time.
Angela, we do actually have one question in the chat from Christina about having residents rotating through their facility. Would they put them in the clinical category?
So typically residents have a preceptor that they work under. So yes, it would be under the preceptor information, right? And it would be a U1 modifier. Any other question? No. Okay. Thanks again.
Thank you, Angela. That was great. Look forward to office hours on Thursday. Okay, well, we're going to just go through a couple last minute things. One thing that we wanted to start the conversation on is about community sustainability planning for the PATH Collaborative. We do anticipate being the facilitators for this CPI through the end of 2026, But we also want to start thinking about what are the pieces that are really valuable that we want to keep, and how do we plan for those to be maintained after the CPI goes away in 2027. So we're going to start these conversations. We'll probably have them throughout the next year and a half or so. So today we wanted to look at what the goals of CalAIM have been and what the goals of PATH are, to see how our CPI is working in that. So our CalAIM goals are really looking at how do we address individuals' physical and mental health needs. How do we improve and integrate care for Californians, which you guys are doing a lot of in this meeting and outside of it through ECM and community supports. How do you all work to be a catalyst for equity and justice in the work you're doing? And then how do we come together and work together to build a healthier state? So those are the CalAIM goals. They're pretty big, they're pretty lofty, but I feel like you all here today are doing a really great job of meeting those goals. And then the PATH collaborative goals are a little bit more narrow, but still quite lofty. And that's really to bring folks together to identify, discuss, resolve implementation issues with ECM and community supports. So that has been really fun to be part of in this collaborative. But if we go to the next slide, we did want to start our community planning conversation by asking you all, what have you found to be valuable in this collaborative, and what do you want to see continue as time goes on with ECM and community supports? Would love to have you come off mute and share. Would love to have you put it in the chat. Would love to hear your thoughts about what you find valuable, what brings you back to these meetings every month.
I really appreciate the hands-on information that we're getting. We get it from finding out about any changes from the state. I love being able to interact with partnership and having Ashley here just to be able to throw a gazillion questions her way. I really just kind of enjoyed that part of it. On the other side of it, I also really enjoyed the collaboration between the different agencies that are providing these services, because I truly believe this, and I think a lot of people do on this call, that it's really important for us to help each other out in this and not be so competitive in nature. Because we are able to, if my populations of focus are in this area and yours are in this area, and gladly give you a participant to help serve, because I know you could do it better than I can if it's not my area of focus. So, and I feel like this group has really bonded a lot of ECM providers and helped prevent some of that competitive nature. So here's my thoughts.
Thank you for sharing, Christina. I saw a lot of head nods going along with your comments, so I think you're in good company here. And I see we have some things in the chat here too. So Caitlin, appreciate you coming here to learn more about ECM community sports. We hope you keep coming back to learn from your peers as well. The DHCS policy updates are helpful, which is great. And then Areta, that you have new partners you're meeting in the community, I think is also a really big goal of ours here. Anybody else want to share anything? Ashley, feel free to share too. I know you've been coming here and putting a lot of work into all of your updates, which we greatly appreciate. So hope that continues as well. Well, if you think of things, feel free to put in the chat, or you can email Ava. We just want to make sure that as we start to plan for what happens at the end of CPI, that we're really gathering the things that are valuable for you and figuring out how to continue supporting those. So appreciate your time. And again, we'll be having these conversations over the next year and a half or so. All right, next slide. All right, I'll turn it over to you, Ava.
Thanks, Gretchen. So we're thinking ahead to our next in-person session, which is going to be in May, on May 20th. Our last in-person session was in Reading, and we'd really just love to get any suggestions that you all have about a location for the next session. Like we did last year, we'd sort of like to spread them out, as much as possible throughout the counties, and would just love to get any ideas you have about locations. Whether it's an organization, an agency that has a meeting space, or just like a specific area within your region. We'd love to get your insight. So I'll just pause there in case anyone wants to drop a suggestion in the chat or voice it over. And you can also email me with any suggestions as well. All right, I'll move us forward just to be mindful of time, but if anyone has any ideas, oh, here we go. There's a couple things in the chat. Okay, great. I'll follow up with you, Christina. Thanks. And if anyone else has any other ideas, please feel free to drop them in the next few minutes or follow up with me as well. So our next session will be our April session on Tuesday, April 22nd at 1:30. I'll drop the registration link in the chat, and then we'll also follow up with that in the post-session emails. I know that we got a little bit of a primer from Angela today on our office hours on Thursday. So please join us for the billing and claims management session on Thursday. I will also drop that registration. I think it's in there a couple times, but I'll drop it again. And also please keep in mind the link will say that it's for the San Joaquin and Stanislaus office hours. That's fine. It's a joint office hours. So go ahead and register anyway, even though it may say that. And then as always, please reach out to us if you, would like any additional kind of one-on-one support. We can always schedule a 30-minute one-on-one about, whatever topic you'd like to discuss. Okay, yeah, Caitlin, I'll drop that in the chat. So just wanted to share one update before we log off for the day. This is actually our last session with Gretchen. She'll be transitioning off of this collaborative. We are so appreciative of everything that Gretchen has done for this group. It's been such a joy to work with her on this project, and I just want to turn it over to Gretchen for any last, words you'd like to share with the group here.
Thank you, Ava. Appreciate it. It's been really fun to work with you guys. I've learned a lot, and I'm sure I'll see you around. I'm still going to be in the CalAIM space. So I look forward to seeing you guys in the future. Thank you so much.
All right. Well, thank you everyone so much. Hope you have a great rest of your week, and hopefully we'll see you in office hours on Thursday. Thanks.